We are back with a look at a highly anticipated report from President Trump's Make America Healthy Again Commission. This report focuses on the health of children, calling them the sickest generation in American history. NBC's Tom Yamas spoke with Health and Human Services Secretary Robert F. Kennedy Jr., who spearheaded the report.
Health and Human Services Secretary Robert F. Kennedy Jr. by President Trump's side, unveiling a long-awaited new report that calls today's kids, quote, the sickest generation in American history, identifying 4 major causes: ultra-processed foods, environmental toxins, lack of exercise and high stress, and the over-prescribing of medicines.
How are you going to get food companies to change the way they do business?
Well, I brought the food companies in 2 weeks after I came into office. And I got a lot of them at that point, that early on, to agree that they were going to do something about it.
But Secretary, what does that mean?
I'm answering your question. I'm answering your question. They said to us, but we need alternative vegetables-based dyes. So we have acted very quickly. We have fast-tracked the approval already last week of 3 new vegetable-based dyes that will allow them to transition to using dyes in their foods that are not petroleum-based synthetic dyes.
The report mirrors many of RFK's priorities, including calling for more scrutiny of vaccines and a review of pesticides. But it offers little in the way of concrete solutions.
In the spirit of government efficiency, why not give us a 70-page report of solutions? Because you could have written this on day one.
Well, this is the first time in history that there's been, my uncle tried to do this in 1962. This is the first time in history that all of government has come out with a consensus document that all the cabinet officials agree on. And that says we are in an existential crisis now in our country.
Finally, Secretary, I'm going to ask you a question that's a little different, but it perplexed some people, and I'd like to get your answer on it. You posted these images of you and your grandkids swimming in Rock Creek Park. There are warnings of high levels of bacteria, that the waters are contaminated, yet you jumped in. Why did you jump in and then dunk your entire body in there?
We weren't swimming in Rock Creek itself. We were swimming in one of the Rock Creek tributaries that, I don't think has those there certainly weren't any warnings. Those creeks belong to the American public. We have a right to use them for swimming, for fishing, and we should be concerned about people who are polluting them rather than people who want to exercise their rights.
Our thanks to Tom Yamas for that interview. Kennedy also said his agency will create a follow-up report with policy recommendations that should come out within the next 100 days. Let's bring in NBC News medical analyst Dr. Vin Gupta to break this down further. Dr. Gupta, good to have you with us. This report put a lot of focus on the long-term risks of ultra-processed foods and environmental toxins to children. From a medical perspective, what do you make of the report's findings? Do you think it accurately, comprehensively addresses the real issues that are affecting the health of our country's children?
No, I don't. Good morning, Joe. It's not accurate or comprehensive by a long shot, because actually the leading cause of death of children under the age of 18 are guns. And the second leading risk factor for ill health is the use of tobacco and then ultimately youth vaping. We didn't see any mention of those 2 big risk factors for either ill health or death amongst kids in this country. And so, no, it's not comprehensive. And then 2, it's really hard to take it seriously because at one moment we're talking about environmental toxins. Yes, I think we can all agree there's all sorts of issues when it comes to environmental health. Right at the moment that the EPA, for example, is being defunded and they're talking about deregulation, or we're talking about SNAP benefits and WIC being potentially cut for 10 million Americans over the next 8 years because of Medicaid cuts, we're talking about prevention of disease, which we know we need access to basic primary care to do well. So there's a dyssynchrony between the policy statement and the branding and what actually they're doing to affect change.
So we've got a commission that is labeling today's kids the sickest generation in American history. I think a lot of experts would probably disagree with that assessment. But was there anything about the report that really surprised you?
Well, first of all, the label that we have the sickest generation doesn't really make any sense either, because in 1900, Joe, the life expectancy of the average American was 47 years. Now it's 78. Everybody attributes that to improvements in public health and medicines that we have, and frankly, in vaccines that are more efficient and provide protection against a range of diseases much more efficiently than they did 100 years ago. So that is the difference.
Speaking of medicines, this report claims there are long-term harms associated with prescribing children certain meds. We're talking about like antibiotics and antidepressants. It's calling for more research. Do you agree with that claim, especially that a medication meant to treat mental health could do more harm than good? I mean, what does the science tell us right now?
Well, Joe, the science tells us that, yes, there's some black box warnings on antidepressants. Let's take that as an example, since they call that out, that potentially, in very rare cases, might cause increased risk of suicidal ideation. It also notes, however, and the science is very clear, that the benefits, especially in kids, of using antidepressants far outweighs any potential risks or black box warnings. So the science has long been settled here that, of course, every medication comes with potential side effects. There needs to be close monitoring, especially of these medications in kids. And yet the benefits clearly outweigh the risks based on many, many studies here. So that's inconsistent with what we know.
Dr. Vin Gupta, good to have you with us. Thank you so much. Coming up, a plot twist in the legal fight between